Hello, doctors. Good evening and welcome to today's discussion. Uh, we'll be this is our third day of this discussion, and we've been making some significant progress. I was able to gather many more questions today, so we'll quickly get into it. So hopefully, we'll cover a lot today. So let me start from this very first question. It's a question about total body water. Who is this now? I don't like this. I'll just remove you. If I have to say this again, I'll remove you. Dr. Mohammed, don't unmute your mic when you know you have nothing to say. All right. So, let me put. And if I remove you, you'll not be able to join again. I've removed you. Okay. So, um, here's the question. It says in a 75 kg man, what's the total body water, intracellular fluid, and extracellular fluid? So basically, testing your knowledge of homeostasis, pediatrics. Physiology. So concerning body weight and body water content. So let us attempt the question. You can decide to type in the chat box the answer that you picked so that we can move very quickly. Our pace will depend on how fast you guys respond to questions. So um, let's try and respond fast. Yeah. What percentage of the body is made of water? If we go like 60% total body water, yes. Okay, so that's like 60% of 75, which makes sense at 45. If it was a 70 kg man, to be 48. And then most of the fluids, is it intracellular or extracellular? Okay, so most of the fluid is intracellular fluid. Then the rest is extracellular, which is also further divided into plasma and other parts. All right, so did I even read out the question? For the benefit of those who will be watching the live stream, the question is, in a 75 kg man, what is the total body water, intracellular fluid, and extracellular fluid? So the options now have three numbers. Option A says 50 liters, 25 liters, and 25 liters. Option B says 60 liters, 40 liters, and 20 liters. Option C says 45 liters, 30 liters, and 15 liters. Option D said 42 liters, 28 liters, and 14 liters. So that's what it looks like. Let me see if there is possibility that this whiteboard will be able to show it. Okay, it's showing on the whiteboard. Yes. Okay, so yeah, so this is the question. This is the question for the benefit of anyone who will be watching this. And most of the candidates are choosing between, they are choosing option C. And based on the answer given by Dr. Khalid, who is moving this thing, 60% of body water is 60% of body weight is water. Okay, so 60% of the body is made of water. So if you calculate for a 75 kg man, what's 60% of 75 kg to give us 45? So you now divide, you know that majority of the water is in the intracellular fluid here, then followed by ECF, which is 15 liters. So we'll choose option C as the correct answer. All right, so let's go to the next question. Um, Hold on while I get the question. This question is testing your knowledge of some of the micronutrients, okay? And it says, which of the following, I'll put it here and still put it here. So it says, which of the following foods does not contain phosphates? Option A says meat, option B, dairy, option C, fruits, and option D, nuts. So which one do you pick? Which of the following foods does not contain phosphates? Option D, nuts. Oh, nuts. Option D, nuts. And someone said Dr. Sam and Dr. Khalid chose option C, which is fruits. Okay, that's the correct answer. Phosphate is actually found in meat, dairy products, nuts, milk, cheese, all those stuff. They contain a lot of phosphates, but fruits have very low amount of phosphates. So option C is the correct answer. Let me see. Is it possible for me to put anything beside these options? Option C is correct. All right. So that's our answer. Let's go to the next one. This question is testing your knowledge of micronutrients. This time around, we're talking about vitamins and their cofactors. Okay, when you talk about vitamins, you must also talk about their cofactors. So, which vitamin requires zinc for optimal activity? Which vitamin requires zinc for optimal activity? I think some people are already responding. From Dr. Khalid, since we are unanimous in this decision, option A, which is vitamin A. Okay, that's correct. Vitamin A is the correct answer. Let's move quickly. Zinc is known as a crucial substance for the activity of retinol binding protein, which is essential for transporting vitamin A, retinol binding protein. Okay, so the next question here is testing your knowledge of leprosy. Just a basic question concerning leprosy. Okay, just a basic question concerning leprosy. You know, when you talk about leprosy, we have palsy bacillary and multibacillary. So look at this question. It says, what does a slit skin smear positive test indicate in leprosy? Does it indicate multibacillary leprosy, palsy bacillary leprosy, tuberculoid leprosy, uh, borderline leprosy? What does it indicate? First of all, the way to go about this is to think about um, if you take a sample from the skin, that's the meaning of this slit skin smear test, right? Take a sample from the skin, you test it. You know, leprosy is very difficult to culture, just like tuberculosis. You know, they are very difficult to culture. And if you are able to get a positive test from this slit skin smear, okay, it means that the amount of the bacteria, I mean the Mycobacterium leprae, okay, that is found in that skin is quite high. So it means it's likely going to be a multibacillary leprosy. It will not be palsy, because palsy means it's very few organisms that are found there. So it has to be multibacillary, which is option A. So that's the correct answer, option A. Option A, all right. So let's go to the next one. Target cells. We are looking at some hormones now. FSH, LH, those type of stuff. So this question says, which cells are stimulated? Which cells are stimulated by follicle stimulating hormone? Option A says Sertoli cells. Option B, Leydig cells. Option C, Teca cells. Option D, granulosa cells. Which cells are stimulated by follicle stimulating hormones? FSH. I used to know that LH, stimulates Leydig cells, like the L for L, that's luteinizing hormone, stimulates Leydig cells, while FSH stimulates Sertoli. But that's it. So FSH stimulates Sertoli cells in males for spermatogenesis, and granulosa cells in females for follicular development. So this question should have should indicate whether we are talking about males or females. Okay, so if you are going to choose Sertoli cells, it means if the question says which cells are stimulated by FSH in males, you will choose Sertoli cells. If the question says which cells are stimulated by FSH in females, you will choose granulosa cells. Okay, so your answer is supposed to depend on what is indicated. Remember that both LH and FSH are found in both males and females, and they are products of the uh, the pituitary gland, anterior pituitary gland. Okay, and they are like hormones that actually stimulate other hormones down there in the testes and the ovary. So both this and this are correct. This is correct in males. And this is correct in females. All right. So we'll move to something else. So in an exam, always keep an open mind because depends on what they ask you. Don't just be a, I don't know, cram and pour. Okay. Vary your answer based on what you are asked. Look at the question, analyze it properly before you pick an answer. All right. So the next question here is a very easy one. Which of the following is not a HASEC organism? So I think the first thing is for you to determine what is a HASEC, like what are the components of this HASEC. So let's, while you guys pick your answers, I'll bring the components of the HASEC. Okay. Have you chosen your answer? Okay, many of you are choosing option C, Enterococcus, and someone chose. Is there was no option E now? Why are you putting Echinella? From where? Echinella is actually part of the HASEC, in case you don't know. So, first rule of an exam is don't answer something that is not there. Second rule is be vigilant. So these are the HASEC group of organisms, Haemophilus species. Okay. So when you say species, SPP, it means species, including H. influenza, Egyptus, Hemolyticus, and so on and so forth, parahemolyticus. Um, Aggregatibacter species. Okay, so these are the A. Then C is Cardiobacterium. That's the C. E is Echinella corrodens, and K is Kingella species, including Kingella kingae, Kingella, yeah, and Kingella auris, and all these other ones. So, Enterobacterium is not a HASEC organism. Okay, so take note of that. Enterobacterium, Enterococcus is not a HASEC organism. So this is the correct answer. Back to our whiteboard. Are you guys following? Please respond so that I'll know that I'm not just talking to myself. Someone can unmute the mic and speak so that I'll know that you can hear me.
Yes, we are following, sir.
All right, all right.
Sorry for putting option E. I mean the right for E is Echinella species in the HASEC group. That's what I meant, not.
Sorry, I didn't get you.
I mean, the reason I put E was that the right organism in the HASEC group was Echinella. I wanted just to write the right
Okay.
organism there.
No, but
Yeah.
the options were correct. It was only one that was not correct now. Haemophilus species is a HASEC organism. Aggregatiba is a HASEC organism.
Yes, I mean,
Cardiobacterium is
yeah,
also a HASEC organism, but Enterococcus is wrong. Do you
it's
get?
wrong. Yeah, yeah.
Yeah. Okay, you wanted to bring the other ones too that are
Yes, yes,
okay,
yes.
okay. So Echinella and Kingella kingae and the other ones that are missing. All right.
Yes, thank you.
So Chief, which one is the correct answer there?
Option what, sir? Option C,
Oh,
enterococcus.
okay, sir.
Enterococcus. Option C. All right, so on to the next one. What is a hapten? Simple question. There's also another variation of this question uh, in previous West Africa exam or national exam, or one of those exams. Something about hapten too. They like questions on haptens because they know candidates always confused about it. So this one is direct. What's a hapten? Options there say option A complete antigen, option B, an incomplete antigen, option C, a type of antibody, option D, a toxin. Mm. You need to know this hapten. They keep bringing it out like in different ways anyway for your exams. Someone chose option B, an incomplete antigen, option C, a type of antibody. No, it cannot be a type of antibody. Once you hear hapten, you know it's antigen. En for En. Antigen has En. Hapten has En. So you know it's a type of antigen, first of all. And every antigen, okay, antigen could be complete or incomplete. Complete in the sense that that antigen alone can elicit immune response. Okay. Now, when you say an antigen is incomplete, it means it requires an additional antigen. Both of them will now bind together before it can elicit an immune response, right? So it's a it's an antigen, but it requires a carrier molecule. Okay, it requires another molecule, a carrier molecule, before it can elicit an immune response. Okay, so I want us to take a look at. Let's ask everybody to explain further about hapten. What's a hapten? Includes details. So when conjugated to a carrier protein, they become immunogenic. Okay, so characteristics of haptens, they have small size, so they are typically small, less than 1,000. I don't know what value is this. Daltons. Okay, Daltons. Low immunogenicity. Okay, so generally they are not immunogenic on their own. Okay, but when they combine with another larger carrier molecule, they now become immunogenic. Then they are also carrier dependent. Uh, you know, so it has to be conjugated before they become immunogenic. So it's that carrier protein that provides a site for the antibody binding. You know, when you mention antigen, antigen is any foreign substance that comes into the body and stimulates an immune response, right? So it's not supposed to be in the body, but when it finds itself in the body, it will stimulate an immune response. And this can range from, organisms like bacteria, viruses, and it can also range to like foreign particles, foreign body, anything at all, right? Examples of haptens: penicillin is a hapten, okay? A small molecule that can cause an allergic reaction in some individuals when conjugated with a carrier protein. Dinitrophenol is also another hapten. Benzyl penicillin is also another hapten, right? So, role of haptens in immune responses. They're very important in autoimmune and allergic reactions. So especially when they are conjugated. So they can stimulate antibody production, they can induce T-cell responses. They are important in allergic reactions, autoimmune disease. So a globulin can also be a carrier protein to a haptin. Another thing here is Klebsiella pneumonia capsular polysaccharide, okay, can be like a carrier protein for a haptin. Okay, so I believe we've covered the important stuffs about haptin. So option B is the answer. Coming back to our whiteboard. Next question. This question is about vital capacity. We talked about this yesterday. Let's see those who paid attention, either yesterday or the first day of our
Class,
discussion.
class.
Talked about long volumes and capacities. Okay, so how do you calculate what is vital capacity? The way West Africa will normally put their question is like vital capacity about, or just say about vital capacity. Okay, so which one is correct there amongst them? If you remember what I discussed yesterday, I said vital capacity is like the volume of air, okay, when an individual inhales maximally and then exhales maximally as well. So the total volume of air that passes through the lungs when an individual inhales maximally and then exhales maximally. All right. So based on that, what do you think? What do you think is the? Can you guys still hear me? What are you saying, Dr. Hillebo? You can't hear me, or I can't hear you. I don't understand what you said there. Okay, so option B. And then remember what I explained about inspiratory reserve volume. It's the volume of air when an individual inhales maximally. That's inspiratory reserve volume. And then expiratory reserve volume is the volume of air when an individual exhales maximally. Tidal volume is the volume of air that passes through the lung during normal quiet breathing. It's like oscillatory in and out, 500 mils, 0.5 liters. Okay, so total lung capacity talks about the entire volume of air in the entire lungs, right? So it sums everything that passes through the lungs. That's total lung capacity, and that's about 6 liters. Vital capacity should be about 5 liters, if I'm not mistaken, or 4.5 liters, something like that. So from this equation, based on what I've described, option B fits the bill. So it means it's tidal volume plus inspiratory reserve volume plus expiratory reserve volume. Okay. There should also be another formula for vital capacity. Let me check. Like if you look at that graph, let me see if I can. So let me formula for vital capacity. Yeah. So I wish I can bring out that graph. There should be another way of deriving vital capacity as well. Okay. Long volumes and capacities. Is that image I used yesterday or the other day? So you can do total lung here. You can do total lung capacity minus residual volume. It also give you the vital capacity. So TLC. Yeah. So this one is also correct. Okay. This one is also correct. All right. If you look at it critically, so total lung capacity minus the residual volume will also give you tidal. Will also give you vital capacity. Okay. So that's basically residual volume is about 1.2 to 1.5, okay, or you can say 1 liter to 1.5 liters, while the total lung capacity is about 6 liters. So if you subtract TLC from RV, you get about 4.5 liters thereabouts, which is 4.5 to 5 liters, which is the VC. VC. All right. So we move to the next one. We answered this question yesterday, so let's see those who are sharp. Okay. Hold on. Just choose the best option, but let's just see what you pick anyway. This question says, which helminth can cause autoinfection? Option A, Ascaris lumbricoides. Option B, Strongyloides stachoralis. Option C, Trichuris trichura. Option D, Encyclostoma duodenale. Ascaris lumbricoides. Okay. Let's answer, please. Let's answer. Let's attempt the question. We already answered this the last time, so I expected you guys to just be fast about it. Okay, we have 2 option B's and 2 option A's. Who will break the tie for us? A and B. Okay, the same guy. Who else? Who will break the tie for us now? Make an attempt, take an educated guess, because definitely in your exam you see questions that you probably have not even come across, or that you didn't study for, or that's like they're just strange, but you're just trying to take an educated guess based on someone who has studied medicine for 7 years or 6 years, depending on, if you include house job, that's 7 years. Then who has practiced medicine for some years, you can take an educated guess about something. So the other day we talked about autoinfection. You need to, when you are studying for an exam, you need to get to the point where when you are seeing a question being repeated, because if you did a good job in what we did yesterday and the day before yesterday, you should be able to answer this question now. Okay, so when questions now start getting repeated, like, you should be happy, because it means, so if you did a good job the last time, it gets easier and easier to follow the class. So we discussed that we listed some organisms. You go back to the video and look at it. We listed some organisms that that cause auto-infection. Basically, the meaning of auto-infection means that it completes its life cycle within the individual. Like it doesn't need a snail somewhere, it doesn't need another third party to complete its life. So it can complete its life cycle within the individual and be passed out in physics, and then the individual can still infect himself. That's the meaning of auto, like same person can still infect himself. So auto-infection. So Strongyloides secularis is one of the major organisms that can do that. Okay. But another organism that can do that, who can identify hookworm from here? Which organism is hookworm among the options? Option D, yes, Dr. Khalid. That's hookworm. So hookworm has two types, Necato americanus and Cyclostoma duodenale. Okay, two are hookworm. Okay, so they also do that, but if like you had one shot, pick option B. Okay, if you have a second shot, if it's this one that appears, pick it. If it's this one that appears, pick it. If it's hookworm that appears, also pick it, because this is also hookworm and they could just write hookworm. All right, so that's about the question. Remember, these are recalls, so we're only trying to reconstruct it in what we think is the manner they may have asked the question. But you use your head. Next question coming up. This is a biochemistry question. West Africa asks a lot of biochemistry questions, so be ready. Which enzyme is absent in skeletal muscle? Option A, pyruvate kinase. Option B, glucose 6-phosphatase. Option C, lactate dehydrogenase. Option D, hexokinase. This is a simple question. Like if you know how these things work, let me put it in the chat box so that you can make out your answer. Okay, so let's attempt the question so that we can move. Our live stream will end in the next 16 minutes, so be fast with your answers. The first thing to know is that skeletal muscles do not store glycogen. Okay, so skeletal muscles do not have the ability to store or break down or use glycogen. So glycogen is stored in the liver. Okay, stored in the liver. Let me draw the liver. Stored in the liver. Skeletal muscles do not have the ability to store glycogen. All right. So what this means is that when you are exercising, for example, after some point, you know what happens in the muscle, you need glucose, right, to power your muscles, to do your exercise, to do your daily activities. So after some time, and for you to get this glucose, you need the process of glycolysis. That's glycolysis. Lysis means to break down, right? So glycolysis means to break down glucose. And when you are breaking down glucose, the final thing you are going to produce is carbon dioxide and water, which will be, excreted from your lungs, right? And in the process, you are going to be producing a lot of lactic acid, okay, lactate, which will need lactate dehydrogenase, so pyruvate to lactate. And lactate is what causes that pain that you feel in the muscle when you have been, some of you should be going to the gym now. And so if you go to the gym, if you do activities that require the gym, right, or even running or jogging, after a while, you start feeling that fatigue and that pain in your muscle. So that pain you are feeling is because of the accumulation of lactic acid, which is a byproduct of glycolysis, right? So after a while, you start accumulating lactic acid. Now, as you keep using the glucose, you are going to start using up the glucose in your blood. Now, after a while, your body will now start asking for more glucose. So what's the easiest place for the body to get that glucose? It will be from the liver. But it was not stored as glucose in the liver. It was stored as glycogen. So through the process of glycogenolysis, that's breakdown of glycogen, you will now break down glycogen. Glycogen is like a compound form of storing glucose. So multiple glucose packed together will now form glycogen, and they will be stored in the liver. So eventually, through this enzyme, okay, you break down glycogen, and release it and push it towards the muscles. Okay, so that's basically what's going on here. All right, so on that note, like, this enzyme is not found in the liver, but it's not found in the skeletal muscle. Meanwhile, all these other ones, because they are components of glycolysis, pyruvate kinase, hexokinase, um, lactate dehydrogenase, all these ones can be found in skeletal muscle because they are components of glycolysis. All right. The next question is something.
Hello, Chief. Which one is the correct answer, Chief?
I circled it now.
Huh?
Option B. Option B. Option B is the correct answer. All right, so the next question simple question that if you do it, you know it, right? It's asking about lateral geniculate pathway. So which organ sorry. So lateral geniculate pathway. Is it visual, auditory? So if you tell me about lateral, you also tell me about medial geniculate pathway. And then you also tell me about the visual pathway. Tell me about the medial geniculate pathway. And you tell me about the visual pathway. Okay. So the lateral geniculate nucleus relays visual information from the retina, to the cortex. Well, not directly from the retina, but like in the full picture. But like if you go through the visual pathway, you now know which particular place. So if these are the two eyes, what is this? Okay, let me just finish it first. Okay. So what's this? These are the eyeballs, right? Eyeball. What's this? You can unmute yourself and talk so that we move fast. What's this? This one. This is 1. This is 2. This is 3. This is 4. This is 5. And then the secret. So, can you guys hear me? What's going on here? What's number 2? Let's answer now. This is primary school anatomy. Or I should leave it. Okay, it's too small. Let me leave it since nobody's answering. Number 2, you're saying medial geniculate. What thing concern medial geniculate? Number 2. This is visual pathway. Number 1 is the eye. Like the retina should be somewhere here. Retina is somewhere here, right? It's collecting signals from different parts of the eye. So what's this number 2? This thing here. Please go and read it up. I'll go to the next. Okay, the answer is visual processing. Okay, that's the correct answer. Option A. Abba, this is primary school anatomy. Why are you guys keeping quiet? Out of 17 candidates, nobody can tell me what is optic tract or what. I'll go to the next question. What's the role of the interstitial cells of Kajal? Option A says, click on the board, you will see it. Click on the board. If you look at the options there, you see one of them is whiteboard. Click on it. What's the role of interstitial cells of Kajal? So, nerve conduction, pacemaker cells of GI, motility, smooth muscle contraction, acid secretion. Whose hand is raised? Dr. Ayokunle, you have something to say? Who is grinding pepper? Is it? Who is grinding pepper? Option B is the answer, right? So, interstitial cells of Kajal are like the pacemaker cells of the GI. Okay, so they release slow impulses, just like SA node. Okay, just like sinoatrial node is in the heart. Okay, interstitial cells of Kajal are there in the gastrointestinal tract to stimulate those slow impulses and lead to contractions. So that's why the bowel is always moving. So that's the answer, option B. Next question. You guys should know that this is a discussion. Like, you have to contribute. You can't just stay quiet. Okay. This postgraduate level now you're going to, so it's not a first year medical school or second year medical school. This is postgraduate, so you need to be able to have a conversation about a topic. You need to be able to say your mind. You need to be able to converse. All right, so it's a discussion. It's not a tutorial, so you should be able to contribute to the conversation, which means you should study, you should read widely, cover your course, and be knowledgeable. The best X-ray position for diagnosing pleural effusion. So is it going to be an AP view, PA view, lateral decubitus, oblique view? Which one should the patient do for pleural effusion? So I'm going to so everybody is correct. So lateral decubitus view, you place the patient on the side with the affected side facing up. So allows the fluid in the pleural space to accumulate at the lungs base, making it easier to visualize on the X-ray. Okay, so better fluid detection, increased accuracy, improved detection of location. Comparison, AP view is good, but it may not be as sensitive as the lateral decubitus. PA view is less sensitive. Oblique view is not typically used for diagnosing pleural effusion. All right, so it's lateral decubitus. Our time is almost up. You can't see the whiteboard. You have to click on it. Were you seeing it before? Were you not seeing it before? You have to click on it to see it.
How do we click on it, sir?
Just the same way, like if you look on the left side, okay, if you're using a phone, like if you see the list of people that are on this chart, you see one of them will be written whiteboard. Click on that one to now come to the center of your screen.
Okay.
What do we do now? I'm seeing it here. I'm still writing on it.
I'll come. Wait.
Is it happening for everybody?
I cannot see it on my own.
Yes, me too.
But can you see anything that is written whiteboard there?
No.
Yes, I saw.
I'm
I
just
clicked
seeing.
on it.
I saw Air Clinic. Only Air Clinic can see.
There's whiteboard, but I've clicked on it, but I'm not seeing your typing.
So what are you seeing now?
Just one arrow.
Which arrow? Can you see it now?
Can you see?
Is it visible now?
No.
You know that you have to are you seeing the whiteboard at all on your screen, or is it that you're not seeing the question on the whiteboard, or that you're not seeing the whiteboard? Because these are two different.
I'm not seeing the whiteboard at all.
So what is on your screen right now?
I'm just seeing the names of the people that are present.
Now, so
Then
click on the one that is the whiteboard. It will now come to the center of your screen. Do you get? Double tap on it, double tap. I think on the phone.
So we are not seeing the whiteboard.
No, look through the list of the people on the listing. One of them is whiteboard. Double tap it to now come to the center of your screen.
Okay, let me see.
Have you seen it?
No, sir.
Check. I'm just seeing the alphabet of the people's name. So I'm seeing.
I can
One of
see
them
it
is
now.
one of them is whiteboard now. Please look through the
Where?
list. You see it. One of
I
the
can see
stuff
it.
in the list there is whiteboard, like it's like a member of the listing. So double tap it, then it will become bold, big on your
Wow,
screen.
the thing is there.
Who is the lady that says she has seen it? Just
It's
tell them
Dr. Nibo.
how you got it.
It's the same thing you have been saying.
Ah.
I saw my name. I saw a clinic, but I cannot see whiteboard.
Just screw down or up, whichever one. Then
Okay.
maybe you see the whiteboard.
So the next question is about cancer. Which cancer is often treated solely with radiotherapy? This is a common sense question, kind of. Cancer is often treated solely with radiotherapy. Prostate cancer, cervical cancer, Hodgkin's lymphoma, and MPC. The live stream will off, so let's answer so that at least this one will enter the live stream.
Hodgkin's lymphoma, nothing for it. I said you. I said it.
You think of a place that is sort of difficult for surgeries, like where you want to tend to avoid surgeries, and something that is also sensitive to you know to radiotherapy. So that's NPC, nasopharyngeal carcinoma, is which makes sense. If it's nasopharyngeal, that place is not somewhere you want to just go and be cutting anyhow, right? So radiotherapy will reach there, and it's very much radio sensitive. Okay, so that's why it's useful in that case. The next question here. Which tests, okay, which tests, if done, will indicate that syphilis has been cured? Syphilis has a what's that
Hello,
classification?
Chief, please. What's the answer for this one you just finished now? Which cancer is often treated solely with radiotherapy? What's the right answer,
Look
sir?
at it. They're not seeing it. Option D, nasopharyngeal.
Okay, sir.
Which test indicates the cure of syphilis? Syphilis has a what's that classification for the tests? Okay, let's take a look at everybody. Classification. Classify syphilis tests. Yeah, exactly. So yeah, non-treponemal and treponemal tests. Okay, that's the investigations for syphilis. So non-treponemal include RPR and VDRL, which is like the commonest screening test. Okay, like the most sensitive screening test, uh, fluorescent troponemal antibody absorption, FTA-ABS test. Then troponemal tests like FTA, TPHA, and TPPA. All right, so these are the tests that are usually used. So screening tests, usually non-troponemal tests are used for screening, while troponemal tests are used for confirmation. Okay, so
Okay.
screening tests like RPR, that's rapid plasma